Good morning and welcome to the Essex Community Tree interview. Would you mind telling me who you are, what you do, and also tell me a little bit about the organisation you run, please?
Of course, thank you, Peter. I'm Wendy Robertson. I'm the Deputy CEO at Thurrock and Brentwood Mind. We are a local mental health charity. We've been around in Thurrock for over 40 years, and then more recently we've spread into Brentwood, so we're trying to grow and develop our services there. We're affiliated to National Mind, but we're an independent charity. And what that means is we have to create services that are needed for local people, and we need to find the funding to get those services up and running. I say lived experience, that's people that have had mental health conditions themselves are at the heart of everything we do. So they help us to design our services, run our services and evolve our services to make sure they're current and they are responding to what's needed. So we try to be as inclusive as possible. Certainly at the moment we are reaching out to people that wouldn't usually access traditional mental health services to find out how we are best to respond and what is needed by us really. So we've got a lot of services under our umbrella, from early intervention right through to crisis support. Some of those services people can just self-refer to by picking up the phone or going via our website and filling out a referral form. We've got low-cost counselling services. We ask for a donation of £10 towards the cost of those, and that's 6 sessions for people. Or if people want longer-term counselling, there is a Mind Talk option for that as well. We have peer support, and that's all about people with shared experiences or conditions coming together to support each other. We have a gardening group, and so people can come along. We know that's really therapeutic to be outdoors and how good that can be for our physical and our mental health as well. We've got Thurrock Carers Service, so that's supporting adults that look after another adult or a child that couldn't look out for themselves, so they need support. We've got accommodation, short-term accommodation, sort of 6 months to 2 years for people that need support to be able to live independently. So there's a lot available out there that people could just refer to on their own. And we do a lot of work with the NHS as well, so we collaborate closely and it kind of complements the medical model and the NHS services that are out there. So we've got a crisis house, we've got a crisis sanctuary, admission prevention, early discharge. So with those, if people call 111 option 2, if they're experiencing a mental health crisis, they will direct them to the most appropriate service, and that could be us as well. There's also a recovery college that we work with, Inclusion Thurrock, so that's courses that anyone can access to help their well-being. So you can see that there's quite a range there, as well as social prescribing models, so that people that are coming that have had severe mental illnesses or common mental health problems, they might need to find out what's available in the local community for support, and we can help people to access other support and services that are around. So as well as that, we've got a suicide prevention website that people can go to and get free training, because we know that's been an issue not just locally but nationally, where people get so desperate that they take their lives, and we want to prevent that wherever possible. And we can do that by reducing the stigma and getting the understanding and the awareness out there into the community, so that people feel able to help in those situations. We couldn't do any of this without our volunteers. We've got a board of trustees that all volunteer their time to keep us on track and govern us and make sure we're doing everything that we should legally, and just to guide our organisation. And I suppose, how can you get involved? Obviously you could access any of the services. If you need support, you could let other people around you know that we're here and what we do, show them the video. But you can also get involved by fundraising or sharing our social media with people, putting on an event that helps us to raise funds so that we can keep our services going.
Thank you very much indeed.